So let's talk about pain. Our pain questions are always kind of difficult. Sometimes they could seem to be subjective. However, when you're thinking about pain, there are different pain skills that you use, but definitely communication with the patient is very important when we're looking at pain, because the patient's pain is not your pain. The pain scale that the patient gives you is according to them. So a post-op patient calls for medication for pain. They state that they'd rate their pain at 4 to 5 on their pain scale. PRN medication has been prescribed. So we've been called to the room. We know that this is a post-op patient, so generally an acute case. They are having pain. So we don't have to call the doctor because we know that they have PRN pain medication so that we can give based on the parameters of the PRN pain medication. So we have, sorry, it hasn't come in that yet. So you can give acetaminophen, 650 milligrams PRN, Q6 hours for pain that's less than 4. Hold the medication and check with the doctor. You can give Percocet 1 tab PO, PRN Q4 hours for pain medication that's between 5 to 7. Or you can call the pharmacist because you're really not sure which one to give. Or you can go ahead and give morphine 1 milligram IV push, Q4 hours for pain 8 to 10. So right away, a couple things that you want to think about is how do we answer the question? What's the priority? What is the question that they're asking? They're asking which pain medication would you give? What is the information that you have on hand? The information that you have on hand is the patient has said that their pain score is 4 to 5. We do know, then the next question is this acute or chronic pain? This is acute pain because they are in the immediate post-op period. Become familiar with the mechanism of action of narcotics. For every medication that you give, you want to understand what the side effects are so that you can anticipate any kind of needs or planning that is needed after you give the medication, or plan, of course, before you give the medication. So their pain level is 4 to 5. So that falls in between 2 different PRN medications. And with this, I would ask the patient which they want. Keep in mind, if it's 1 day post-op, you might want to consider Percocet so that they can move around better and they can cough and deep breathe. One of the key things that I like to share with nurses with teaching when you're in the environment is that a lot of, I'm going to rely on my experience here. A lot of people are afraid to take pain medication because they don't want to be addicted to pain medication. When I'm educating my patients about pain medication, especially in the immediate post-op period, when I offer pain medication, teenagers, for one, they don't want to take pain medication because they're afraid of being addicted. And what I share with them is that you've had a procedure or something has happened to you, whether it's trauma or something like that, that has caused you to have pain. This is an acute period. You need to get on top of that pain so that then you can actually increase your mobility and you can move and do your ADLs. So in this instance, when I'm thinking about this client who has a pain scale of 4 to 5, it's a fresh post-op patient, I need them to be at their optimum. I need them to be pain-free, because when you're pain-free, that's when you could move around. That's when you could do your deep breathing exercises. That's when you could be effective in PT for whatever reason that you're there. So that's why it's very important to consider those things when you're giving pain medication. Now, let's look at what the answer was. So I'm just gonna go. So the answer is to give Percocet 1 tab PO, PRN Q4 hours for pain, 5 to 7. And one of the things that I like to think about is that, so when we look at the answers, you could give Tylenol, but know that it might not be effective, especially if it's an immediate post-op period for acute pain that they're having. Morphine, this is one of the things that you're going to consider. It's a no. It's For pain, it's 8 to 10. This patient is not telling you that they're having excruciating pain. They did not tell you that their pain score was that high. And then also, if you were to give morphine, then you definitely want to consider the side effects of what that looks like if you were to give morphine, especially if their pain was only 4 to 5. So giving Percocet 1 tab, PRN, Q4 hours for pain. Now, the other thing that I want to dive a little bit into, and this is not necessarily an Nclex question, maybe on the next gen Nclex, is that if you give 1 tablet PRN for pain, Q4 hours, they tell you that their pain is 4 to 5. You give them pain medication, and then understanding how long it takes for the pain medication to kick in, and what the peak levels of this pain medication of Percocet is going to be. So now we're 2 hours into it. Now, this person has said they are still having excruciating pain, or they're still having pain that's unrelieved, and they say it's still maybe a 5 or maybe even higher. This is where you're going to not call the pharmacist, but you're going to want to have a conversation with the physician, because your goal is to keep the client safe and give them effective care. Now, if you call the physician, things have changed. They've given you PRN pain medication. However, it's not effective for this client. So do make that call with your assessment of what you've seen. We're now 2 hours in. According to the parameters that you're given, you cannot give any more pain medication. So you will need to have a call. And generally what will happen is the physician may tell you to give another Percocet, or may give something else, or may give some Tylenol or something to support that patient's pain. But do know that if you're 2 hours into it now and they're still having pain, it's not something where you say, okay, you have to wait for 4 hours. That is not effectively taking care of your patient, especially having acute pain. You're going to want to call the doctor, and then things will have to change. Things may change. So that's just how to take care of that scenario.